morning, everyone. We're so glad you're here for this webinar on New International Practice Guide to Supporting Implementation, and then the critical role of relationships in implementation practice and evidence use. And we're really excited that you're all here. So because there's so many of you, and as you can see, folks are still joining, all of your phone lines are muted and your videos are not enabled, so you can really relax and be off camera. We're excited to see the chat is warmed up, so please use chat to share questions and ideas. And as Allison mentioned, feel free to respond to all attendees, not just to the panelists, so we can build our larger group relationship by chat. We will be keeping an eye on chat, and we're going to do our best to make sure that all of your voices are heard that way. This session is being recorded and it will be posted to our websites. And there's going to be a very quick evaluation at the end, and we hope that you'll just take a few minutes to complete that for us. So who is gathered here today in this virtual space? So as we can see in chat, we have people from all over the world. It's really exciting. In terms of the type of agencies that's represented, you can see on the slide that we have a good number of folks from higher education as well as the nonprofit sector. State government is in the house, local government, we have hospitals, schools, federal government, and even military and faith-based groups represented. So we're glad to have all that diversity of thought in the room. We can see the service types that best describes your work as well up there in implementation science. So we have a lot of you experts on this call. So welcome, folks in public health and mental and behavioral health, education, child welfare, health and criminal justice. And we also have a nice diversity of how many years you've been in the field. So we have folks that have been around for a minute, over 15 years. To folks that are new in this space. So welcome to everyone. So glad that you're here. When we think about our identities around race and ethnicity, we can see that we are not bringing as many perspectives to this space as we would like to. So definitely something to aspire to be more diverse and engaging lots of identities in our work together. And we see that we have a lot of folks here from North America. Europe is in the house, Asia and Africa, South America, Australia. So this is wonderful as we continue to grow this work together. So speaking of all of those different countries, we have a warm-up poll for you. So we would like to know, what is your favorite time of day? Is it morning, afternoon, evening, night? So let us know. I think the poll is open, right?
The poll is launched and we have votes coming in. We're just at about 200 and rising. Folks are very engaged this morning or afternoon, depending on where you live. And we're about at 250, starting to slow down. Let's go ahead and end the poll there. And I will share results. Looks like, does those show up for you, Sarah?
Yes, we are morning. We are generally morning folks.
Yeah.
Hopefully, especially our person who sits like 7 a.m. Definitely, hopefully you're a morning person. So that's great. Morning and evening are some good times for us. That's exciting.
Maybe that's the time to implement, is the morning. Sarah.
Morning, exactly.
That's really interesting.
Time for change is the morning. Although I do not believe that I hear from Oscar out there is definitely apparently not.
Oh, he's a night owl. Yeah. That's right.
Let's see, next slide. Okay, so we have one more warm-up poll. We ask you to be honest. So hand on heart right now, are you wearing PJs, pajamas? And so your options are never, of course, business top, pajama pants, sweats on bottom, or I just changed into my work clothes a minute ago. I mean, there is something magical about Zoom, right? You can just zoom on in. All right, so let's see.
I am excited to see these data come in. This is a very elusive empirical question, and I'm excited to see what we get.
Me too.
We have some very I think, forthcoming folks. I'm going to go ahead. We're at 256. Let's end the poll there. Let's share results.
Yep, there we go.
Oh my God, it was basically a tie between Never and those admitting that business on top, PJs on the bottom, or sweats or yoga pants or whatever people have on the bottom. I love it.
Very exciting. We all know who's going to have an easier time adjusting back to the real world right now, the Nevers. Great. Awesome. Well, thank you all for taking a few minutes to connect with us. This is our Twitter handle, #UNCImpSci2020. And we will keep putting that in the chat from time to time in case you forget, or in case you just hear something and you're like, gotta tweet that. So we'll keep that in the chat as you see. But please do feel free to share ideas that you hear to generate some conversation outside of this space as well. So with our time together, we have a lot planned and a lot of voices to bring into this space. And our objectives are, first, we want to introduce a new international practice guide for supporting implementation. It's developed through a collaboration with the European Implementation Collaborative, the Center for Effective Services, and the National Implementation Research Network. And we also want to discuss new research findings on the role of trusting relationships in supporting evidence use and identify areas for future research and implementation practice. Really exciting. And so this is what the morning is going to look like, or afternoon, or wherever you are. So we've just done this welcome and stage setting, and then we're going to have an overview of the revised competencies and an introduction to the practice guide. Then we'll hear the overview of findings from the William T. Grant project. And then we're going to move into a fireside chat on the role of relationships for supporting evidence use. And then we'll preview what's ahead. We promise there will be a little break in there and hopefully some really engaging conversation. And the chat is going to be even more interesting if you chat, ask questions. So again, please continue to, as you have questions, put them in the chat and engage with us in that way. And I think I'm turning it over to Allison.
Thanks so much, Sarah. We're so happy to have everyone on today. It's an amazing turnout for this event on a Friday in December as we slog through this year together. So thank you guys so much. I'm going to do a very quick overview of all of our speakers, and they will pop up at different points in the next 2 hours together. But just wanted to give a list of them here because it's absolutely so amazing. So we have Bianca Albers, with the European Implementation Collaborative and also the Center for Evidence and Implementation in the UK office there. Christine Andrews with Child Trends in the US, Katie Burke, the Center for Effective Services in Ireland and Northern Ireland, Annette Boas, Kingston University and St. George's University of London in the UK, Jennifer Voss with 0 to 3 in the US, Bob Franks with the Judge Baker Children's Center in the US, Carrie James, the Child Welfare Information Gateway, also here in the US, and Sue Kearns, the Center for Effective Interventions at the University of Denver, myself, Allison Metz with the National Implementation Research Network, and the School of Social Work at UNC Chapel Hill, and Sarah, who has been welcoming us, who is the director of the Jordan Institute for Families at the School of Social Work at UNC Chapel Hill as well. So our speakers and moderators for today are most welcome, as well as all of our participants. And as Sarah said, we have a lot to cover, and we're trying to do it in kind of little inputs followed by some Q&A, and we will have a 5-minute stretch break between the first section and the second section. So you'll be able to stand up and get some coffee and kind of hang in there with us, hopefully. So I am going to kick us off. It'll be myself and Katie Burke with the Center for Effective Services, and Bianca Albers with the Center for Evidence and Implementation. And we are going to present the revised competencies for implementation support practitioners. And as Sarah said, we have just released a practice guide for implementation support. And so it'll be us that kind of jump in with this first section of the webinar today. So excited for that. So you'll see here some screenshots of these two new products that we put together. Again, a collaboration of the European Implementation Collaborative, Center for Effective Services, and NERN. And this collaboration has been going on for about 3 years. And we are so excited about these products, honestly. So they should be being put in the chat as we speak. There are links to them on all 3 of the organization websites. So you can go to NERN, you can go to EIC, you can go to CES, and the products are all there. They'll also be on our event page at the Jordan Institute for Families. So we're excited to have them in multiple locations and hope you take a moment to download these as we're talking and get a peek at them. They are truly hot off the presses and we finished them, I think, the final version last night. So we are so happy to share as quickly as that. The competencies, people might be familiar with them. We actually released a version of these in June of 2017. And I wanted to note why we're coming back with a revised set is that over the last 3 years through this collaboration, we have conducted a lot of research on the roles and competencies of professionals who provide implementation support. This has resulted in some journal articles we published this year, one on consolidating the evidence base for professionals that do provide implementation support, and also have just published with Bianca at the helm there, an integrative systematic review on implementation strategies and the skills that are required for, again, professionals providing implementation support. We hope to have out another article in early 2021 on the results of an international survey we conducted of folks that provide implementation support, work in the area of implementation science with a focus on implementation practice. So with all of that information coming in over the last 2 to 3 years, we have, I think, a really amazing refined set of competencies. And so you'll see that there. And then we have just, again, this is the first issue of the practice guide to supporting implementation. So it takes those competencies and it talks about, well, how would we actually use those and apply those in our day-to-day work. So we're absolutely thrilled for the practice guide and hope that that is really helpful to those doing the kind of work that we do with helping organizations and systems use evidence to improve outcomes for a range of focus populations. So why was this guide developed? Well, I can say, a big piece of that was Katie Burke telling us all this research we were doing was great on implementation competencies, but we had to make sure we also did a practical product as part of this work, something people could pick up and use. But really, over the years, Bianca and Katie and I and colleagues have been a part of helping to put these products together, Leah Bartley, Karen Ward, Laura Lewison, just a bunch of folks at the Center for Effective Services and NERN and the EIC. We have a really deep interest in the competencies for providing implementation support and have thought so much about this question because as we seek to build the capacity of the organizations and systems we work with to use the best of implementation science. So research in implementation has yielded important theories and frameworks and strategies and tools. But what happens is when we introduce these, people say, yeah, this makes sense. I really like this framework, but how would I use it? Who would I need to bring together? How do I make a decision of which strategy to use? So we get those questions a lot about the skills it takes to actually provide implementation support. And we know those skills go beyond the actual frameworks or tools because it's people that need to do this work. And also many of us teach in graduate programs in public health and nursing and social work and education. And we know a lot of our graduate students are learning a lot about implementation science and are really interested in these frameworks and strategies and theories. And the same question comes from them. Well, how would I use this? What would be some of the first things I would do if a community needed support in implementing something? So we knew that we would really not be able to improve outcomes for populations and build a workforce if we couldn't really define the skills and competencies that it takes to apply these frameworks and strategies in practice. And so that's really the goal of both of these products, is to help us be able to do that. So you can see here that we have a working definition of implementation support practitioners as part of the article where we consolidate the evidence base on professionals that provide implementation support. We really recognize that they can be called all different things, you know, facilitators, implementation specialists, consultants, coaches, but we really wanted to consolidate that under the title of implementation support practitioners and see them as professionals who support organizations, leaders, and staff in implementing evidence-informed practices, programs, and policies. So really, these individuals are those that identify and then contextualize and improve the evidence implementation strategies that are emerging from implementation research. And so they're taking those strategies, contextualizing them, figuring out which ones to use, and improving them in practice, and hopefully are contributing to an important feedback loop between implementation researchers and implementation practitioners. We know that implementation support practitioners may reside outside of a service system. So it could be that you're working with a university or an intermediary organization that provides implementation support. Sometimes those practitioners reside inside service systems, organizations, and agencies, because more and more we're seeing units, divisions within government agencies and other places that are dedicated to implementation. So we think that these products and tools hopefully come at a really important time where we can continue to grow a workforce that can use the best of implementation science in practice every day. So what does the guide aim to do? Well, it does aim to do what I'm describing, to define the roles and functions of implementation support practitioners, to really help cultivate a workforce of implementation support practitioners. So again, as we think about the training and capacity building that we're doing in government agencies and nonprofit sectors every day, as well as the work that we do with students in higher education and how it is that we can continue to develop skills, not only in implementation research, but also in implementation practice. We want this guide to really help those doing this work to be able to reflect and learn on their own practice and to be able to talk with colleagues. We think this guide can also help communicate what we do, because for a long time, it was hard for us to figure out what should we call ourselves and what is it that we do and how do we communicate that to partners and funders. And we think, again, it can support feedback loops between implementation researchers and those in implementation practice. So with that, I'm going to turn it over to Katie Burke from the Center for Effective Services, who is going to provide an update on these competencies and walk us through those.
Thanks, Alison. So I get to start the update on the competencies, and then I'm going to hand on to Bianca and Alison. But before I dig in, greetings from my attic in Dublin. It's really nice to see everybody here and great to have such a spread of professions and locations and everything. So I hope that'll lead to some really interesting and maybe some challenging questions for us. So start thinking about those as we go. So this is our visual, our graphic that we have developed to provide an overview of the principles and the competencies that we are proposing anybody who is supporting implementation should look to develop. Alison explained this is based on this is based on both the implementation science literature and indeed other forms of literature, but also real world practice. So people who are doing this in the real world. So if you look at our graphic, we have various names for it. I call it the wheels and Bianca calls it the flower. Okay, so we're looking for a good name for this graphic. If you have any, please help us. But I'm going to stick with my wheels. And if you look at the middle wheel, the white inner wheel, they are the 6 principles that should underpin all of the work of those professionals who support implementation. And I'm going to come back to those in a minute. So if you see those, they're in the white circle, not quite in the middle, but in the outer rim of the middle. And then we have 3 other circles that are, if you like, growing from those principles or emerging from those principles. And they are the 3 domains. And you will see, I'm going to talk a little bit about those in a moment. So 3 domains: co-creation, engagement, ongoing improvement, and sustaining change. And linked to each of those domains are a number of competencies. So for example, in the left-hand corner, co-learning. These are what Alison has been talking about. These are what we have defined as the competencies, the skills and competencies that those professionals who are supporting implementation should need. And what we have done is, based on the literature review and based on the feedback from the international surveys, we have grouped the competencies into the domains. So I'm going to introduce you briefly to the 3 domains. So I'm going to start with the top wheel / flower / bubble, whatever we want to call it: co-creation and engagement. So this is about active involvement of stakeholders in all stages of the implementation process. And what are the competencies you need to ensure that you have the active involvement of stakeholders in all stages of implementation? So our work to date has identified 5 competencies that are needed in relation to this domain. And they are co-learning, brokering, addressing power differentials, etc. So the second domain, so I'm moving around our flower / wheel now to the right-hand side, to ongoing improvement. That's the second domain. And this is about using data and feedback to improve implementation as you move through the different stages of implementation. So again, here we've identified 6 competencies, actually, including a number of ones that we have added in the last number of months based on feedback we got from groups like this and from the survey and from our review of the literature. So for example, we've pulled out and added as a specific competency communication, which surprisingly maybe it wasn't there in the very beginning. And facilitation, I think, was one of the ones that we have evolved a little bit. And then the third domain I want to talk about is at the bottom of the wheel. That makes it sound less important, and it's certainly not less. It is no less important than the other 2. In fact, many would argue it's almost more important than the other 2, because it's about sustaining whatever change we're trying to do. So that's about ensuring that the interventions are delivered with integrity after whatever initial implementation support you've put in place is withdrawn or diminished. So will the intervention sustain on an ongoing basis? And is there enough of the core components of that intervention left to keep it going? And the work we've been doing collaboratively has identified 4 competencies around that domain, which are, as I say, down the bottom of the wheel, but actually really important. So the final thing I want to say on this visual, so suggestions in the chat, please, for what we could call this visual. That would be really helpful to us. In the practice guide and in the practitioner profile, for each of those 15 competencies, we've identified the key activities or the functions that the professionals who support implementation will fulfill with that competency. And we've also provided some helpful hints for how you might apply that competency in the real world. So I'm going to move on now to talk a little bit about the principles. So how have we described, or what do we mean by principles is the first thing, I guess. So the principles are the foundational attitudes which the professionals who support implementation should use in all aspects of their work every day, in terms of how they make decisions, in terms of how they interact with communities and organizations and stakeholders. So we've identified 6 principles, which we believe underpins the work of implementation support practitioners. Again, these have evolved over the last number of years, so they're not the same as they were at the beginning. The 6 are: to be empathetic, to be curious, to be committed, to advance equity, to use critical thinking in our work, and to embrace cross-disciplinary approaches. I'm not going to mention each of them. They're all outlined in more detail in our lovely documents. I'm going to just say a couple of words about a couple of them. So firstly, being empathetic. This is about approaching whatever change process you're involved in with regard for others, and viewing and treating the others involved in the implementation process as legitimate, respected, and valuable contributors to the process. So the next one I'm going to mention is about being committed. And I think that's a really important principle for anybody who's supporting implementation. That involves us bringing patience, being resilient, being willing to challenge the status quo, being able to be flexible when we hit barriers, and being agile about how we address various setbacks in implementation. And the third one I'm going to mention is embracing cross-disciplinary approaches. So that's about using different ways of knowing and the diversity of expertise across different disciplines to bring about mutual and transformative learning. So I'm going to pass on now to Bianca.
Right, so what is going to happen now will be that we will dive into each of these domains by just highlighting a single competency, knowing that you will have the resources available to really understand the others. And I will be talking a little bit about addressing power differentials, which is a slightly interesting competency that we identified. A power differential can exist when the influence of one person or group involved in an implementation is different from that of another group or individual involved in the implementation. And it can be there, of course, as a consequence of different formal levels of formal authority. A senior manager typically has greater decision-making power than frontline staff, and that alone can influence how the people that you as an implementation support practitioner work with as they participate in the process, speak up, or engage, or not do that and do the exact opposite and remain quiet and shy and not particularly engaged in the implementation process and in your implementation support. A power differential may also emerge from less formal dynamics in, let's say, in the form of nurses or social workers feeling inferior to the physicians on a team that you are working with as an ISP, or in the form of disguised discrimination against particular individuals or groups involved in your implementation, or in other forms. There is a variety of reasons for such power differentials being present in an implementing system. Often, the differential will be at play between others that you are working with. In that case, you would work to take this differential into account in the way you tailor your support, and you do that tailoring so it becomes possible for individuals and groups at risk of being disengaged from the implementation due to these power differentials to remain a strong, emancipated part of it, to have a voice, to exert influence in that implementation. But it's important to keep in mind that a differential also can involve you as an implementation support practitioner directly. For example, when you, as an external actor who is brought into an organization to facilitate change, but you realize that the physicians whom you are supposed to support and whom you depend upon in your work for change do not take you seriously because you might not have the right education or background or any other type of characteristic that could help you get a good standing in your particular implementation context. And in that situation, you may need to, let's say, carefully consider your entire approach to providing support probably confront the problem more directly, probably trying to find allies in the organization that has brought you in and wanted you to provide the support to find strategies, so you can get your most important implementation stakeholders on board of your support process. But no matter what, this is surely a competence that requires, I would say, a good degree of sensitivity and awareness of what is going on in the relationships between others and between you and your stakeholders. I think I am going, yep, that will be
Back
okay.
to me. Thanks, Bianca. So I'm going to talk briefly now about the second bundle of competencies that are all about improving as we go, ongoing improvement. You know that great phrase, start and get better? I always think that's a great piece for implementation. You know, if we wait to be perfect, we might not get there. So what are the competencies that we need to improve as we go, ongoing improvement? And a lot of these competencies will help to ensure that whatever organization or service we're working in or with will really value learning as part. Organizational learning will be a core part of that service and organization. So the competencies are listed there. I'm going to speak particularly to the one in orange for a moment, which is the competency to apply and integrate a range of different implementation framework strategies and approaches. So the research evidence and the practice of people who are doing this work says that we as implementation support practitioners should be familiar with a range of frameworks, strategies, models, conceptual models, applied models, frameworks. And we should work with the implementation teams that we have and the governance structures we have to decide which of those framework strategies, approaches, and what package of them will be appropriate to whatever we're trying to achieve with our implementation, and will work in the context or the settings where we are implementing, because we're going to talk about that in a little while. As we all know, the context and setting has a very important, is really crucial. You have to adapt to that. And then no, that's all I'm going to say for the moment. I'm now going to hand back.
Wow, okay, that was quick, Katie. That was great, though. And
we're meant to be quick at this part, I remind you.
We are meant to be quick at this point. It's so great, though. And I love the fact that you picked that one to highlight, only because we don't want to be leading with a specific framework or strategy all the time. It is what an implementation support practitioner does well, is kind of looking at things and kind of figuring out that package, as you said. I'm going to turn to sustaining change. And as you can see there, there's a number of competencies we talk about, many of which are relational in nature, some technical, but quite a bit of relational skills are involved in helping to sustain change. I'm going to highlight the developing teams one and just say a couple things about that. The first is that, you know, as an implementation support practitioner, we really see teams as a way to support stakeholder-driven leadership and distributed leadership in an organization or system. And that's really critical for change efforts, to have multiple people taking on different tasks and leadership roles and building the capacity of those individuals to really have a joint sense of accountability for the change effort. So teams are critical for not only launching, but sustaining change. And if you think about our role, and this is where the skills do matter so much to talk about, is developing teams is hard, you know, kind of figuring out who to bring. But as an implementation support practitioner, we are often developing team charters. People kind of figure out the scope and boundaries of that team's work, figuring out the membership for that team, you know, really doing composition analysis to make sure that there are diverse voices. We often facilitate those teams in the beginning with the goal of transitioning that facilitation task to team members as part of our capacity building efforts to build the capacity of teams to take on implementation without the need for external support. So there's a lot of skills that are involved in convening, developing teams, and really launching them as kind of the architecture to support change. So you'll see a lot more about that in the competencies and guide documents. I'm going to turn this over to Bianca, who's going to talk about some dilemmas that we face as implementation support practitioners. And I love these dilemmas, and I hope everyone finds them as interesting as we all do.
Yeah, I hope implementation support practitioners don't experience them too often, but they're definitely there. And they're important to highlight. There are 4 of them, where you could say dilemma number 1. On the one hand, the literature reflects quite a high level of competency characterizing implementation support practitioners. On the other hand, there seem to be, at the moment, still in most countries in which we work, very few pathways for their professional development that can cater to the needs for knowledge and skill building they might have. And that is probably because they operate as a very particular location, this nexus of policy, practice, and research, and not within just one of these fields, which makes it more tricky to professionally develop them, which of course raises the questions how to adequately develop and support implementation support roles in the future. And I have no clear answer to that, but that's an interesting question to consider. Dilemma 2. On the one hand, implementation support work appears to foster high expectations in organizations that bring them in or develop them, that organizational change is kind of at the core of their work, and the implementation support practitioner comes in to enable that change. But on the other hand, they may be ill-equipped to facilitate this change because of the way in which their roles and responsibilities are defined and established. I guess you might know this as an implementation support practitioner, but the literature shows it as well, that the roles often are fairly new, and they often have no clear career pathways in the organization where they are established. And that makes it difficult to really be very, very clear at the moment on what an implementation support practitioner does, which raises the question, how can these roles become more clearly defined and thereby better to become true agents of change? Dilemma 3, on the one hand, it appears to be important that implementation support practitioners operate as allies to those they support. On the other hand, they are also expected to track performance data often, to evaluate staff, the people they support. And this evaluative role potentially undermines the alliance that implementation support practitioners depend upon in their work, which again raises the question, how can implementation support practitioners ensure to maintain strong relationships with their supportees, even though there are these tensions in their role descriptions? Which may be linked to the final dilemma, which is that often the same organizations and systems that invite ISPs in or develop ISP roles and want them to facilitate change, they end up getting in the way of that exact change that they request, because there is an inherent inertia in these organizations that can make it difficult for them to respond positively and in an agile fashion to what an ISP suggests and wants to change. So the organizations and systems may have good intentions, but when they then understand what the change implies, the messages of the ISPs, they sometimes get second thoughts and don't provide the ISP with the support, with the tools, with the resources that are needed to facilitate change, which raises the question, how can this inherent inertia of the context in which ISPs work more effectively be broken up so ISPs have a better chance to achieve what they were hired to do in the first place? And as I said, no quick answers here, really interesting dilemmas that I think are worth debating in practice and continue to research in science. Good. This is, we're about to end this is to show you that we included 10 reflective questions at the very end of this guide. They were, the guide together with the practice profile were developed to help those engaged in implementation and support to reflect on their work, the way in which their own or others' role has been set up, or the experience they gather in their support activities. And at the very end of the guide, we added these 10 reflective questions to enable that kind of thinking. And we hope you might find them useful. We would be very interested in hearing how you use them over time, if you use them. And if you think there are further questions that would be good for us to consider, send them to us, and we will take them into account in preparing the next iteration of this guide, because this will not be the last version, I think. And then finally, some acknowledgements, because the work on all of this, which included the practice guide itself, multiple iterations of that document, conducting the survey and the systematic integrative review, that very much depended on the support from others. And we therefore want to take this opportunity to send a big thank you to, of course, our own organizations that provided this support, the European Implementation Collaborative, NERN, and the Center for Effective Services, and then the colleagues involved in crunching data, writing texts, helping to shape it all up. And they are listed on the left-hand side of the slide, and we cannot thank them enough for being part of this, and actually to still throw in quite a few hours of work, because we are not done yet. Alison mentioned coming publications, and there will be multiple, so there's more to come. And again, thank you to all of these colleagues.
Great, I have stopped sharing, and we can move into some Q&A that Christine Andrews is going to help moderate. I think we have about, you know what, we'll see. We have about 5 minutes, but we might actually go to 7 minutes and make our stretch break 2 or 3 minutes and not 5. So we'll see. Thanks, Christine.
Sure. Good morning, good afternoon, good evening, everyone. Thank you so much for participating and for the great questions that are coming into the chat box and the Q&A box. I see your questions too. Thank you. We only have a few, very few minutes for questions. So I'm just going to jump in and pose a few to our panelists and see if we can get a couple answered. The first one, and maybe this is a quick one to answer, is there a specific order to implement the competencies?
Will I go?
Yes, go for it, Katie.
So no is the answer. And I probably should stop there, but I will say a bit more. No, definitely not. That would be a really bad way to think about the competencies. So think about them as, I don't have anything that will be understood in an American context, a bowl of fruit with lots of different kinds of fruit. You have to pick, you select what you need. If you are the implementation support practitioner, you will, one of the competencies is knowing which ones you're kind of using more and less in different contexts. And I will say one other thing, no one human being can ever have all of those competencies, because they would be, I don't know, they would be way too good. So I also think it's important to think about building your team, building that competencies amongst the team, or a couple of people, 2 or 3 people who might have it.
Thank you. Okay, this one might take a little bit longer, but I think it's more than one person is probably thinking this. So this one says, could you speak to finding the line between holding fidelity to the program being implemented while also incorporating community context and not damaging relationships with the community? So navigating that, I feel like many people are thinking that.
Should I give it a go?
Go for it, Bianca.
Okay. So I think just in the context of the implementation support practitioner role, it's important to keep in mind that we actually have a lot of different evidenced interventions in mind, with some of them having clear fidelity criteria probably, but quite a few interventions basically relying on a single systematic review, and you would even be involved as the ISP in practice design. Just want to put that up front to highlight that this guide really doesn't take a particular program focus, but has a very broad understanding of what it means to grab some evidence or an evidenced practice or intervention and help others to implement it well. That's one thought. The second thought I had is I and my organization, my current organization, I think we increasingly pivot towards David Chambers' dynamic sustainability framework as a way of thinking about the need to strike the balance between fidelity and adaptation, and really view whatever you implement as something that is surrounded by multiple circles, and you need to do continuous improvement work in order to understand, so where is the best fit between whatever I implemented here and the context around it, which of course sends implicitly, I think, a message about you need to have a certain flexibility in your intervention to make that work happen. And sometimes particular aspects of programs are non-negotiable. And if they are in the way of getting a nice fit with your context or your community, then you probably need to consider the entire foundation for the program itself. But otherwise, if you have that kind of flexibility, for me, it would be really an iterative improvement process that you would engage in, and likely a longer one, because it takes time to create this good match between intervention and context.
Can I squeeze in one more? And they were like right at the hour. All right, this one is about accountability of the ISP. To whom and for what is the ISP accountable?
Well, I'll start. Do you want to go, Alison? Do you want to go?
You go.
Okay, so I think there's two pieces to this. One is there is a reality that you are normally commissioned, contracted, funded by an organization, an entity, whatever. Okay, so that's just a practical thing, and there are a lot of kind of technical issues around accountability to those, reporting and all of that. We could talk about that and some of the dilemmas that creates for an implementation support practitioner. But in my experience, most skilled implementation support practitioners feel an accountability to whatever they are implementing. So they feel a real responsibility to implement the new practice or the new approach to caring for older people at home, evidence-informed, really well. So that's an accountability to deliver whatever it is they're trying to deliver well. Now that's much more nebulous accountability, but in my experience, really skilled implementation support practitioners have that. That's more a value, I guess, than an accountability.
I just want to say one thing, I think, because I think it'll come up later, and I would love for we come back from the break and we're going to do a fireside chat with some really insightful people. Is a role of the implementation support practitioner, is advocacy a part of that role? And it's not, in the competencies, and I do think it is a dilemma that we face, because I think we do feel accountable to what we're implementing and to the people that we're hoping benefit from what we're implementing. So exactly. We were often asked in this next step that we're going to go through after our quick break, asking people about stakeholder engagement, engaging communities, engaging residents, people with lived experience. And, a lot of folks we interviewed for the study we're going to be talking about in a few minutes did talk about the fact that sometimes they wondered if their role was to advocate with a funder for more engagement, to advocate, with a public agency they're working with. And we haven't talked about that enough, but I think we do often find ourselves morally grappling with that and wanting to maintain integrity to the approach in the midst of a lot of complicated things that Bianca touched upon around power differentials. And we do try and address that in the competencies, but I think it's a really big conversation. So this idea of who we're accountable to, practically speaking, as Katie said, and then also in other ways, I think is an important conversation for us to have. Thank you for that.
Okay, thank you also panelists for trying to squeeze in some answers. We have a bunch of great questions, both in the chat and the Q&A, and we are saving the questions. We are planning to get back to folks after the webinar and put out responses. So please keep them coming. We will get to them, even though we can't answer them all right now. We're gonna take a very quick stretch break just to get the Zoom fatigue out and just look away to another screen for a few minutes, or look away from a screen for a few minutes. We're going to come back in just about 2 minutes, guys, and we'll see you soon.